management. The nursing management for epiglottitis is super important, so please pay attention as we dive right into it. First and foremost, monitoring and assessment. Continuous monitoring of that child with epiglottitis is very important because they will come in respiratory distress. So you have to be able to assess the respiratory status. Continuously monitor for any respiratory distress. Remember, I spoke to you about how you can monitor, realize that the client is using the accessory muscles of respiration. There's flaring of the ala nesi, is opening and flaring, and then there will be increase in the heart rate of the client. And yes, you have to monitor the oxygen saturation regularly. And then in case there are any changes with the respiratory status, you have to report immediately to the primary healthcare provider, to the doctor. And the safety of the child is super important. When that child is so anxious and restless because of the epiglottitis, you are not to leave the child unattended to. Do not leave the client alone. We have to support the child in a position of comfort. You realize that when they assume the tripod position, they are able to breathe well. So make sure that the client is seated in bed and is in a comfortable position. That would help with their breathing. And you have to encourage the parent or the caregivers to hug and cuddle the child to provide some comfort, because the child will be restless and anxious. And this is so crucial because epiglottitis can be fatal. So medical emergency protocol, we should always have our resuscitation equipment ready and should be prepared in case there's complete obstruction. We should be ready for endotracheal intubation so that the client will be able to breathe, so that we'll be able to maintain the airway. And yes, in this state of respiratory distress, we have to keep the child nil per os, so nothing but mouth for that period when the child is in so much distress. And yes, we have to avoid oral interventions. This is so key, and you can be tested on it. You have a clinical scenario, a client has symptoms, and all the symptoms that you have been given and the signs, everything points to epiglottitis. And in your options, they're saying that, oh, get your spatula and then examine the throat. No, you do not have to pick that. We have to put off any examination, because if you're going to do anything to the oral cavity, get into the airway, you might cause a lot of spasms and cause airway occlusion, which will be fatal to your client. So please, please, please never fall for this. Do not put anything in the mouth to do any assessment in that child who has been diagnosed of epiglottitis. So you are not going to take oral temperatures. No. You are not going to obtain throat cultures at that time. No. And you're not going to do any examinations and manipulations that you want to visualize the posterior pharynx. Do not put anything in the mouth for any assessment. These actions can cause spasms and airway occlusion. And with positioning, keep the child upright, can provide cool, humidified air to aid in the breathing and reduce the swelling, the airway swelling. And calming the child is also very important. Calming techniques and hydration. You want to keep this child calm as much as possible because they come in with a lot of anxiety. So we have to implement measures to reduce the anxiety, reduce the agitation. And please, as I said earlier, we do not leave that child alone, and you're not going to use any restraints because they are agitated. You're not going to help the situation. And then by way of hydration, when the child is calmer, we end the airway, which is the very important part, A, B, C. So airway is very important. When it's secured and child is calmer, we can now initiate IV therapy to ensure proper hydration.